ವೀರಭದ್ರಯ್ಯ ಅವ್ರು ಬಂದಿದ್ದಾರೆ.
ನಮಸ್ತೆ ಸರ್.
ಬಂದಿದ್ದಾರೆ ಸರ್, ಬಂದಿದ್ದಾರೆ.
ಮಾಡರೇಟರ್ 3 ಜನ ಬಂದಿದ್ದಾರೆ.
ನಮಸ್ಕಾರ ವೀರಭದ್ರಯ್ಯ.
ನಮಸ್ಕಾರ ಸರ್. ಯಾವಾಗ್ಲೇ ನಮಸ್ಕಾರ ಮಾಡಿದೆ, ಕೇಳಿಸ್ಕೊಳ್ಳಿಲ್ಲ ನೀವು.
ಸಾರಿ ನಮಸ್ಕಾರ.
ಸುರೇಶ್ ಸರ್, ವಿ ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್.
Yes sir, yes sir. Good evening everyone, all the respectable members. ಎಲ್ಲರಿಗೂ ಇವತ್ತು ಸಂಜೆಯ ವಂದನೆಗಳು. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘ ಕರ್ನಾಟಕ ಶಾಖೆಯ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿಯ ವತಿಯಿಂದ ತಮಗೆಲ್ಲರಿಗೂ ಈ ಎರಡನೇ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿಯ ಎರಡನೆಯ ಒಂದು CME ಪ್ರೋಗ್ರಾಮಿಗೆ ತಮ್ಮೆಲ್ಲರಿಗೂ ನಾವು ಹೃತ್ಪೂರ್ವಕವಾಗಿ ನಾವು ಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತೇವೆ. ಮೊದಲನೇದಾಗಿ ನಮ್ಮ ಶಾಖೆಯ ಅಧ್ಯಕ್ಷರಾದಂಥ ಡಾಕ್ಟರ್ ಚಿನ್ನಿವಾಲರ್ ಸರ್ ಅವರಿಗೆ ನಾವು ಫೋನ್ ಮಾಡಿ ಕೇಳಿದಾಗ ವಾರದ ಯಾವುದೇ ಒಂದು ಈವ್ನಿಂಗ್ ನಾನು ರೆಡಿ ಆಗಿರ್ತೀನಿ, ನಾವು ಈ ಇಂಥ ಒಂದು ಒಳ್ಳೆಯ ಕಾರ್ಯಕ್ರಮ ಮತ್ತು ಎಲ್ಲರಿಗೂ ಇದಾಗ್ತದೆ, ಅವರು ಕೂಡ ನಮಗೆ ಆಶ್ವಾಸನೆ ಕೊಟ್ಟು ಮತ್ತು ಇದು ಕಾರ್ಯಕ್ರಮವನ್ನ ಮುನ್ನೋಡಿ ಮಾಡಲು ಅವರು ಕೂಡ ಬಂದಿದೆ. ಅವ್ರಿಗೂ ಕೂಡ ನಾವು ಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತಾ, ಅದೇ ತರನಾಗಿ ಈ ಶಾಖೆಯ ಯಾವುದೇ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಇವತ್ತು ನಮಗೆ ಬೆನ್ನೆಲುಬಾಗಿ ನಿಂತಿರ್ತಕ್ಕಂಥ ಕಾರ್ಯದರ್ಶಿಗಳಾದಂಥ ಸೂರ್ಯರಾಜು ಸರ್ ಅವರು ಕೂಡ ನಾನು ಹೃತ್ಪೂರ್ವಕವಾಗಿ ಬರಮಾಡಿಕೊಳ್ಳುತ್ತಾ, ಅದೇ ತರನಾಗಿ ಇವತ್ತು ಈ ಶಾಖೆಯಲ್ಲಿ ಈ ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಅನ್ನ ನಾವು ಚೆನ್ನಾಗಿ ಇವತ್ತು ಎಲ್ಲರಿಗೂ ಯಾವುದೇ ಒಬ್ಬ ಡಾಕ್ಟರ್ MBBS ಡಾಕ್ಟರ್ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡಬೇಕಾದ್ರೆ ಯಾವ ತರನಾಗಿ ಆತ ಕನ್ಫ್ಯೂಷನ್ ಆಗಿರ್ತಾನೆ, ಯಾವ ತರನಾಗಿ ಆತ ಲೀಗಲ್ ಆಗಿ ಇವತ್ತು ತಮ್ಗೆಲ್ಲ ಗೊತ್ತಿರತಕ್ಕಂಥ ಒಂದು ಮೆಸೇಜ್ ಏನಪ್ಪಾ ಅಂದ್ರೆ ಪ್ರೊಫೆಷನಲ್ ಎಥಿಕ್ಸ್ ಅಥವಾ ಮಿಸ್ಕಂಡಕ್ಟ್. ನಾವು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡುವಾಗ ಯಾವ ತರ ನಾವು ಮಿಸ್ಕಂಡಕ್ಟ್ ಅಂದ್ರೆ ಏನು, ಪ್ರೊಫೆಷನಲ್ ಅನ್ಎಥಿಕ್ಸ್ ಅಂದ್ರೆ ಏನು, ಇದು ಅನೇಕ ಇವತ್ತು ನಾವು MBBS ಆದ ನಂತರ ಅನೇಕ ಸೂಪರ್ ಸ್ಪೆಷಾಲಿಟಿ ಕೋರ್ಸ್ಗಳ ಮುಖಾಂತರ ಮತ್ತು ಅನೇಕ ತರಂತ ನಾವು ಸರ್ವಿಸ್ಗಳನ್ನ ಕೊಡುವ ಒಂದು ಮುಂಚೂಣಿಯಲ್ಲಿ ಇವತ್ತು ಮಾಧ್ಯಮದ ಮತ್ತು ಸಮಾಜದಲ್ಲಿ ನಾವು ಅನೇಕ ಭಯಂಕರವಾದಂತ ವಾತಾವರಣ ಇತ್ತೀಚೆಗೆ ನಾವು ಎದುರಿಸ್ತಾ ಇದ್ದೀವಿ. ಆ ಕುರಿತಾಗಿ ಇಂಥ ಒಂದು ಒಳ್ಳೆಯ ಒಂದು ಟಾಪಿಕ್ ಅನ್ನ ನಾವು ನಮ್ಮವರೇ ಆದಂತ IMA ಡಾಕ್ಟರ್ಗಳಾದಂತ ಮತ್ತು ಅತ್ಯಂತ ಹೆಸರುವಾಸಿಯಾದಂತ ಎಲ್ಲ ಶಾಖೆಗಳಿಗೂ ಪರಿಚಯವಾದಂತ ನಮ್ಮ ಮಿತ್ರರು ಇವತ್ತಿನ ದಿನ ಸ್ಪೀಕರ್ ಆಗಿ ಮತ್ತು ಮಾಡರೇಟರ್ ಆಗಿ ಜಾಯಿನ್ ಆಗಿದ್ದಾರೆ. ಅವರಿಗೂ ಕೂಡ ನಾನು ಮತ್ತೊಮ್ಮೆ ನಮ್ಮ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿ ವತಿಯಿಂದ ನಾನು ಬರಮಾಡಿಕೊಳ್ಳುತ್ತಾ, ಇವತ್ತು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಮ್ಮ ಎಲ್ಲ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿಯವರು ಅತ್ಯಂತ ಉತ್ಸಾಹದಿಂದ ತಾವೆಲ್ಲರೂ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಇವತ್ತು ಎರಡನೇ ಬಾರಿಯಾಗಿ, ಲಾಸ್ಟ್ ಟೈಮ್ ಕೂಡ ನಾವು ಮೋರ್ ದನ್ 100 ಮೆಂಬರ್ಸ್ಗಳನ್ನ ನಾವು ಬರಮಾಡಿಕೊಂಡು ಅನೇಕ ಕಾರ್ಯಕ್ರಮ ಅತ್ಯಂತ ಯಶಸ್ವಿಯಾಗಿ ನಾವು ಮಾಡಿದ್ದೀವಿ. ಅದೇ ತರನಾಗಿ ಇಂಥ ಒಳ್ಳೆಯ ಟಾಪಿಕ್ ಅನ್ನು ಇವತ್ತು ಸೆಲೆಕ್ಟ್ ಮಾಡಿರ್ತಕ್ಕಂಥ ನಮ್ಮ ಎಲ್ಲಾ ಮೆಂಬರ್ಗಳಿಗೂ ಕೂಡ ನಾನು ನನ್ನ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಕಮಿಟಿ ವತಿಯಿಂದ ಮತ್ತೊಮ್ಮೆ ಅವರಿಗೆ ಸ್ವಾಗತವನ್ನ ಕೋರುತ್ತೇನೆ. ಅದೇ ತರನಾಗಿ ಇವತ್ತಿನ ಈ ಒಂದು ಮಾಡಿರ್ತಕ್ಕಂಥ ಈ ಒಂದು ಟಾಪಿಕ್ ಇವತ್ತು ನಾವು MBBS ಆದ ನಂತರ ಯಾವ ತರ ನಮ್ಮಲ್ಲಿ ಆನೆಸ್ಟಿ ಆಗಿರಬೇಕು, ಯಾವ ತರ ಮಾರಲ್ ಆಗಿರಬೇಕು, ಮತ್ತು ನಮ್ಮಲ್ಲಿ ಪೇಷಂಟ್ ಮತ್ತು ನಾವು ಸೊಸೈಟಿಯಲ್ಲಿ ಯಾವ ತರ ನಾವು ಟ್ರಸ್ಟ್ ಅನ್ನ ನಾವು ಇಡಬೇಕಾಗ್ತದೆ, ಮತ್ತು ಅನೇಕ ಲೀಗಲ್ ಆಸ್ಪೆಕ್ಟ್ಗಳನ್ನ ನಾವು ಫೇಸ್ ಮಾಡಬೇಕಾಗುತ್ತೆ, ಮತ್ತು ಫ್ರಾಡ್ ಅಂದ್ರೆ ಏನು, ಸೆಕ್ಷನ್ 35 ಅಂದ್ರೆ ಏನು. ಸೊ ಈ ತರ ಒಂದು ಕೋರ್ಟ್ ನಲ್ಲಿ ನಾವು ಅನೇಕ ತರ ಭಯಂಕರವಾದಂತ ಒಂದು ಸಂಗತಿಗಳನ್ನ ನಾವು ಎದುರಿಸ್ತಾ ಇದ್ದೀವಿ, ತಮಗೆಲ್ಲ ಗೊತ್ತಿದೆ. ಮತ್ತು ಅದಲ್ಲದೆ ಇವತ್ತು ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್, ಕರ್ನಾಟಕ ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ತನ್ನದೇ ಆದಂತ ಒಂದು ಘನತೆಯನ್ನ ಹೊಂದಿದೆ. ಅದರಲ್ಲಿ ನಾವು ಎಲ್ಲ ಡಾಕ್ಟರ್ಗಳು ಇವತ್ತು ಆಂಧ್ರದಿಂದಾಗಿರ್ಲಿ, ತಮಿಳುನಾಡಿಂದಾಗಲಿ, ಇವತ್ತು ಇತ್ತೀಚೆಗೆ MBBS ಆಗಿ ತಾವು ಏನು ಹೊರಬರ್ತೀರಿ ಅವರಿಗೆ ಯಾವ ತರ ನಾವು ಕೌನ್ಸಿಲ್ದಲ್ಲಿ ನಾವು ರಿಜಿಸ್ಟ್ರೇಷನ್ ಮಾಡ್ಕೋಬೇಕು, CME ಅಂದ್ರೆ ಏನು, ಕ್ರೆಡಿಟ್ ಪಾಯಿಂಟ್ಸ್ ಗಳಂದ್ರೆ ಏನು, ಮತ್ತು ನಾವು ಯಾರಾದ್ರೂ ಯಾವ ತರ ಎಲಿಜಿಬಲ್ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಿ ಕರ್ನಾಟಕ ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್, ಮತ್ತು ಎಫಿಷಿಯಂಟ್ ಸರ್ವಿಸ್ ಮಾಡ್ಲಿಕ್ಕೆ ನಾವು ಯಾವ ತರ ನಾವು ಮುಂಚೂಣಿಯಲ್ಲಿ ಇರಬೇಕು. ಸೊ ಇಂಥವೆಲ್ಲ ಅನೇಕ ತರವಾದಂತ ಈ ಸಂಶಯಗಳನ್ನ, ಡೌಟ್ಗಳನ್ನ ನಾವು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಬಗೆಹರಿಸಿಕೊಂಡು ಈ ಕಾರ್ಯಕ್ರಮ ಅತ್ಯಂತ ಯಶಸ್ವಿಯಾಗಿ ಮುನ್ನೋಡ್ಲಿಕ್ಕೆ ಮತ್ತೊಮ್ಮೆ ತಮಗೆಲ್ಲರಿಗೂ ನಾನು ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತೇನೆ. ಮತ್ತು ಈ ಕಾರ್ಯಕ್ರಮದ ಪ್ರಾರ್ಥನೆಯನ್ನ ಮಾಡ್ಲಿಕ್ಕೆ ನಮ್ಮ ಕಾರ್ಯದರ್ಶಿಗಳಾದಂತ ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜ್ ಅವರಿಗೆ ನಾವು ವಿನಂತಿಸಿಕೊಳ್ಳುತ್ತೇನೆ. ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜ್ ಸರ್.
ಎಲ್ಲರಿಗೂ ವಂದನೆಗಳು ಮತ್ತೆ ನಮಸ್ಕಾರ ಮತ್ತು ವೆಲ್ಕಮ್. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ, ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ, ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆಯ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯವಾಗಿರಲಿ. ವಂದನೆಗಳು.
ವಂದನೆಗಳು ಸರ್. ಈಗ ಮುಂದಿನ ಕಾರ್ಯಕ್ರಮ ನಮ್ಮ ನೆಚ್ಚಿನ ಅಧ್ಯಕ್ಷರಾದಂಥ ಡಾಕ್ಟರ್ ಚಿನಿವಾಲರ್ ಸರ್ ಅವರು ಈ ಕಾರ್ಯಕ್ರಮ ಕುರಿತಾಗಿ ಅಧ್ಯಕ್ಷೀಯ ಭಾಷಣವನ್ನು ಮಾಡಬೇಕಂತ ಕೇಳ್ಕೊಳ್ತೀನಿ.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಕೇಳ್ತಾ ಇದೆಯಲ್ರಿ?
ಎಸ್ ಸರ್ ಕೇಳ್ತಾ ಇದೆ.
ಇಂದಿನ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಸಬ್ ಕಮಿಟಿಯ ವೆಬಿನಾರ್ಗೆ ಆಗಮಿಸಿದಂತಹ ಎಲ್ಲ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸದಸ್ಯರಿಗೆ, ಕಾರ್ಯದರ್ಶಿಗಳಾದಂತಹ ಡಾಕ್ಟರ್ ಸೂರ್ಯರಾಜು, ಪ್ರೆಸಿಡೆಂಟ್ ಎಲೆಕ್ಟ್ ಮತ್ತು KMC ಮೆಂಬರ್ ಆದಂಥ ಡಾಕ್ಟರ್ ವೀರಭದ್ರಯ್ಯ, KMC ಮೆಂಬರ್ ಆದಂಥ ಡಾಕ್ಟರ್ ಪವನ್ ಕುಮಾರ್ ಪಾಟೀಲ್ ಮತ್ತು KMCಯ ಉಪಾಧ್ಯಕ್ಷರಾದಂಥ ಡಾಕ್ಟರ್ ರವಿ ಕೃಷ್ಣಪ್ಪ ಅವರಿಗೆ, ಅಲ್ಲದೆ ಎಲ್ಲ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸದಸ್ಯರಿಗೆ ನಾನು ಸ್ವಾಗತ ಕೋರುತ್ತಾ, ಈ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಸಬ್ ಕಮಿಟಿ ಕಡೆಯಿಂದ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಕಾಗಲ್ಕರ್ ಮತ್ತು ರಾಜೇಂದ್ರ ಪ್ರಸಾದ್ ಅವರು ಒಂದು ಒಳ್ಳೆಯ ಕೆಲಸವನ್ನು ತಮ್ಮ ಇದರಿಂದ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಪ್ರತಿಯೊಂದು ಉಪಸಮಿತಿಗಳು ಸಹ ತಮ್ಮ ಕಾರ್ಯವ್ಯಾಪ್ತಿಯನ್ನು ಇಲ್ಲಿ ತಮಗೆ ಕೊಟ್ಟಂತಹ ಒಂದು ಉಪಸಮಿತಿಯ ಜವಾಬ್ದಾರಿಯನ್ನು ಚೆನ್ನಾಗಿ ನಿಭಾಯಿಸಿಕೊಂಡು ಏನಂತೆಲ್ಲ ಸಾರ್ವಜನಿಕರಿಗೆ ಅಲ್ಲದೆ ನಮ್ಮ ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸದಸ್ಯರಿಗೆ ಒಂದು ಒಳ್ಳೆಯ ಸಲಹೆ ಸೂಚನೆಗಳನ್ನು ಮಾರ್ಗದರ್ಶನವನ್ನು ನೀಡುತ್ತಾ ಬಂದಿದ್ದಾರೆ. ಸೊ ಈ ಒಂದು ಬಂದಂಥ ಇವರೆಲ್ಲರಿಗೂ ನಾನು ಹೃತ್ಪೂರ್ವಕವಾದ ಒಂದು ಸ್ವಾಗತವನ್ನು ಕೋರುತ್ತಾ, ಈ ಒಂದು ಸಮಯದಲ್ಲಿ ಈಗ ಡಾಕ್ಟರ್ ವೀರಭದ್ರಯ್ಯನವರು ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ಆ್ಯಕ್ಟ್ ಬಗ್ಗೆ ಮಾತಾಡುತ್ತಿದ್ದಾರೆ. ಆಮೇಲೆ ನಮ್ಮ ಪವನ್ ಕುಮಾರ್ ಅವರು ಪ್ರೊಫೆಷನಲ್ ಎಥಿಕ್ಸ್, ಮಿಸ್ಕಂಡಕ್ಟ್ ಆ್ಯಂಡ್ ಮಾಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಬೈ ಅಂತ ಇದೆ. ಸೊ ಈ ಒಂದು ಸಂದರ್ಭದಲ್ಲಿ ನಾನು ಒಂದು ಇತ್ತೀಚೆಗೆ ನಮ್ಮ KSB ಆಫೀಸಿಗೆ ಒಂದು ಲೆಟ್ರ್ ಬಂದಿದೆ. ಅವರು ಒಬ್ಬ ವೈದ್ಯಕೀಯ JJ ಮೆಡಿಕಲ್ ಕಾಲೇಜಿಂದ MBBS ಪಡೆದು ಅಂಥೇಳಿ, ಆ ನಂತರ ಈಸ್ ಪ್ರಾಕ್ಟೀಸಿಂಗ್ ಎಟ್ ಮೈಸೂರು ಆರ್ ಬೆಂಗಳೂರು. ಸೂರ್ಯರಾಜುಗೆ ಇದ್ರ ಬಗ್ಗೆ ಪೂರ್ಣ ಗೊತ್ತಿದೆ, ಆದರೆ ಅದನ್ನು ನಾವು ಏನಂತಲ್ಲ KMCಗೆ ಕಳಿಸಲಿಕ್ಕಾಗಿ ಅದು ಫೇಕ್ ಸರ್ಟಿಫಿಕೇಟ್ ಅಂತ ಗೊತ್ತಾಗಿದೆ. ಅದರ ಬಗ್ಗೆ ರವಿ ಕೃಷ್ಣಪ್ಪ ಅವರು, ವೀರಭದ್ರಯ್ಯ ಮತ್ತು ಪವನ್ ಕುಮಾರ್ ಮೂವರನ್ನು ನೀವು ಮೆಂಬರ್ ಇದ್ದೀರಿ. ಅದರ ಬಗ್ಗೆ ಕೂಲಂಕುಷವಾಗಿ ನಮ್ಮ ಸೂರ್ಯರಾಜು ಕಡೆಯಿಂದ ಮಾಹಿತಿ ಪಡೆದುಕೊಂಡು ಏನಂತಲ್ಲ ಅದನ್ನು ಮುಂದೆ ಈ ರೀತಿಯ ಈಗ 2 ಕೇಸ್ಗಳು ನಮ್ಮ ಮುಂದೆ ಬಂದಿದ್ದಾವೆ. KMC ಅಂತಲ್ಲ ಸರ್ಟಿಫಿಕೇಟನ್ನು ಡೂಪ್ಲಿಕೇಟ್ ಮಾಡ್ಕೊಂಡು ಬೇರೆಯವ್ರ ಹೆಸರಲ್ಲಿ ಇನ್ನೊಬ್ಬರು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಸೊ ಇಂತಹ ಪ್ರಸಂಗಗಳು ಬಂದಾಗ ನಮ್ಮ IMA KSB ಏನಂತಲ್ಲ ಇಟ್ ಇಸ್ ಎ NGO, ನಾನ್ ಗೌರ್ಮೆಂಟ್ ಆರ್ಗನೈಸೇಷನ್. ಇದರಲ್ಲಿ ಯಾವ ತರಹದ ಒಂದು ಮಹತ್ವದ ಏನಂತ ಅಧಿಕಾರ ಇಲ್ಲ ಚಲಾವಣೆ ಮಾಡಲಿಕ್ಕೆ. ಆದರೆ KMCಯಲ್ಲಿ ಇದಕ್ಕೆ ಇದೆ. ಸೊ ಇದು KMC ಇದನ್ನು ಏನಂತದ ಅವರ ಕೂಲಂಕುಷವಾಗಿ ಅವರ ಇತಿಹಾಸವನ್ನೆಲ್ಲ ಪರೀಕ್ಷೆ ಮಾಡ್ಕೊಂಡು ವೆದರ್ ಈಸ್ ಕರೆಕ್ಟ್ ಪರ್ಸನ್ ಆರ್ ನಾಟ್, ವೆದರ್ ಈಸ್ ರಿಜಿಸ್ಟರ್ಡ್ ವಿತ್ KMC ಆರ್ ನಾಟ್, ಅವನ್ನೆಲ್ಲವನ್ನು ನೋಡಿ ಅವರಿಗೆ ಒಂದು ತಕ್ಕವಾದಂತಹ ಶಿಕ್ಷೆಯನ್ನು ಏನಂತಲ್ಲ ಜರುಗಿಸಬೇಕು. ಇಂತಹ ಘಟನೆಗಳು ಮುಂದೆ ಆಗದಂತೆ ಸಹ ನೋಡಿಕೊಳ್ಳಬೇಕು ಅಂತೇಳಿ ನಾನು ರವಿ ಕೃಷ್ಣಪ್ಪ, ವೀರಭದ್ರಯ್ಯ ಮತ್ತು ಪವನ್ ಕುಮಾರಲ್ಲಿ ನಾನು ಕೇಳಿಕೊಳ್ತಾ ಇದ್ದೀನಿ.
ಖಂಡಿತ ಸರ್, ಮಾಡೋಣ ಸರ್. ನಾನು ಫಾಲೋ ಅಪ್ ಮಾಡ್ತೀವಿ ಸರ್.
ಅದೇ ಈ ಸೂರ್ಯರಾಜು ಹತ್ರ ಡಿಟೇಲ್ ಇದೆ. ಸೂರ್ಯರಾಜು, ಹಲೋ. ಅವು 2 ಕೇಸ್ ಬಂದಿದ್ವಲ್ಲ?
ಹೌದು ಸರ್.
ಒಂದು ಹನುಮಂತರಾಜ್ ಅಂತ ಒಂದು, ಇನ್ನೊಂದು ಯಾವ್ದೈತ್ ನೋಡ್ರಿ.
ಹೌದು ಸರ್, 2 ಕೇಸ್ ಬಂದಿದ್ದು.
ಇದು ಟಾಪಿಕ್ ಮುಗಿಲಿ, ನಂತರ ಡಿಸ್ಕಸ್ ದಿಸ್ ಮ್ಯಾಟರ್ ಆಫ್ಟರ್ವರ್ಡ್ಸ್ ಆರ್ ಮೆಸೇಜ್ ಟು ದಿ concerned persons like Vice President and also the KMC member, not in this quorum you have to discuss this matter. What I mean, ಹೌದಲ್ಲ ಸರ್ ಕೃಷ್ಣಂ ಸರ್? ಪವನ್ ಅವರಿಗೆ ಮತ್ತು ವೀರಭದ್ರ ಅವರಿಗೆ ಹೇಳ್ತಕ್ಕಂಥದ್ದು, ಇದನ್ನ ನಮ್ದು ಇದು ಸಬ್ಜೆಕ್ಟ್ ಮುಗಿಲಿ ಏನಿದೆ ಅನ್ನೋದನ್ನ ಆಮೇಲೆ
ಇದು ಮುಗಿದ ಮೇಲೆನೆ
ಎಸ್ ಅಧ್ಯಕ್ಷರಿಗೆ ನಾನು ಹೇಳಿದ್ದಲ್ಲ, ವೆದರ್ ಇಟ್ ಇಸ್ ಕರೆಕ್ಟ್ ಆರ್ ನಾಟ್ ದ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಪರ್ಸನ್.
ಯಾಕಂದ್ರೆ ಈಗ ಲೆಟರ್ಸ್ಗಳು ನಮ್ಮ ಬರ್ತಾ ಇದಾವೆ.
ಎಸ್
ಈಗ ಮೆಡಿಕಲ್ ಎಥಿಕ್ಸ್ ಅಂತಾನು ಇದೆ, ಮಾಲ್ ಪ್ರಾಕ್ಟೀಸ್ ಅಂತಾನು ಇದೆ ಇದರಲ್ಲಿ.
ಇದಾದ್ಮೇಲೆ ಬೇಕಾದ್ರೆ ಯು ಕ್ಯಾನ್ ಟೇಕ್ ಇಟ್.
ಅದಕ್ಕೆ ಅವ್ರ ಒಂದು ಗಮನಕ್ಕೆ ನಾನು ತರ್ತಾ ಇದ್ದೀನಿ ಅಷ್ಟೇ.
ಓಕೆ ಓಕೆ
ಓಕೆ, ಗೋ ಅಹೆಡ್ ಸುರೇಶ್.
ಹಾ ಸರ್, ವಂದನೆಗಳು ಸರ್. ಚೆನ್ನಾಗಿ ತಾವು ಕಾರ್ಯಕ್ರಮದ ಅಧ್ಯಕ್ಷ ಭಾಷಣವನ್ನು ಹೇಳಿದಿರಿ. ಅದೇ ತರನಾಗಿ ಇವತ್ತು ನಮ್ಮದೇ ಮೆಂಬರ್ ಆದಂತ ಡಾಕ್ಟರ್ ಇಂದಿರಾ ಮೇಡಮ್ ಅವರು, ದೊಡ್ಡಬಳ್ಳಾಪುರದಿಂದ ಇಂದಿರಾ ಮೇಡಮ್ ಅವರು ಈ ಕಾರ್ಯಕ್ರಮದ ಕುರಿತಾಗಿ ಮತ್ತು ಸ್ಪೀಕರ್ ಕುರಿತಾಗಿ ಮತ್ತು ನಮ್ಮ ಈ ಕಾರ್ಯಕ್ರಮದ ಉಪಸ್ಥಿತಿ ಇರತಕ್ಕಂತ ಮಾಡರೇಟರ್ ಕುರಿತಾಗಿ ಹೇಳ್ಬೇಕಂತ ಹೇಳಿ. ಡಾಕ್ಟರ್ ಇಂದಿರಾ ಮೇಡಮ್.
ಎಸ್ ಸರ್, ನಮಸ್ತೆ.
ಹಾ ಪ್ಲೀಸ್.
ಇಂದಿನ ಕಾರ್ಯಕ್ರಮ ತುಂಬಾ ಅತ್ಯುತ್ತಮವಾಗಿ ಬೇಕಾಗಿದ್ದಂತ ಕಾರ್ಯಕ್ರಮ. ನಂಬರ್ 1. ನಂಬರ್ 2, ನಮ್ಗೆ ಒಂದು ಚೌಕಟ್ಟನ್ನ ಕೊಡ್ಬೇಕು. ಎಲ್ಲರೂ ಯಾವ ರೀತಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾರೆ, ಏನ್ ಮಾಡ್ತಾರೆ ಅಂತ ಒಂಥರ ನಾವು ಕತ್ಲಲ್ಲಿ ಇರ್ತೀವಿ. ಅದಕ್ಕೆ ನಾವು ಕರೆಕ್ಟ್ ಆಗಿ ಬೆಳಕನ್ನು ಕೊಡ್ಬೇಕು. ಆ ಒಂದು ನಿಟ್ಟಿನಲ್ಲಿ ನಾವು ಇನ್ನೊಬ್ಬರಿಗೆ, ನಾವು IMA ಮೆಂಬರ್ಸ್ ಆಗಿ ಇನ್ನೊಬ್ಬರಿಗೆ ಹೇಳಕ್ಕೆ ನಮ್ಗೆ ಅಧಿಕಾರಯುತವಾಗಿ ಅಥೆಂಟಿಕ್ ಆಗಿರುವಂತ ಇನ್ಫಾರ್ಮೇಶನ್ ನಮಗ್ ಬೇಕು. ಮೊದಲನೇದಾಗಿ ನಾ ಅದಕ್ಕೋಸ್ಕರ ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಆಯೋಜಿಸೋದಕ್ಕೆ ಎಲ್ಲರಿಗೂ ಸಂತೋಷವಾಗಿ, ಎಸ್ಪೆಷಲಿ ಸುರೇಶ್ ಸರ್ಗೆ ಮತ್ತೆ ನಮ್ಮ ರಾಜೇಂದ್ರ ಪ್ರಸಾದ್ ಅವ್ರಿಗೆ ಧನ್ಯವಾದ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಇನ್ನು ನಮ್ಮ ಸ್ಪೀಕರ್ಸ್ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕಂದ್ರೆ ಎಲ್ಲರೂ ತುಂಬಾ ದೊಡ್ಡ ದೊಡ್ಡ ಮಹಾಮಹಿಮರು, ಜಾಸ್ತಿ ಅವ್ರ ಅಕಾಡೆಮಿಕ್ ಅಕ್ಲಾಡ್ಸ್ ಇದೆ, ತುಂಬಾ ಚೆನ್ನಾಗಿದ್ದಾರೆ. ಸೊ ಮೊದಲಿಗೆ ನಾನು ರವಿಕೃಷ್ಣಪ್ಪ ಅವ್ರನ್ನ ಪರಿಚಯ ಮಾಡ್ತೀನಿ. ದಯವಿಟ್ಟು ನನ್ನ ಕ್ಷಮಿಸಿ, ನಿಮ್ಮ ಪರಿಚಯವನ್ನು ಬಹಳ ಚಿಕ್ಕದಾಗಿ ಮಾಡ್ತೀನಿ. ನೀವು ಕೊಟ್ಟರು.
ಖಂಡಿತ ಮೇಡಮ್, ನಮಗೂ ಅದು ಬಹಳ ಇಷ್ಟ ಆಗುತ್ತೆ.
ಸರಿ ಸರ್. ರವಿಕೃಷ್ಣಪ್ಪ ಅವರು ಈಗ ಸದ್ಯಕ್ಕೆ ನಮ್ಮ IMA KSB ಇಲ್ಲಿ ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಸಬ್ ಕಮಿಟಿನಲ್ಲಿ ಈಗ ಅವರು ಮಾಡರೇಟರ್ ಆಗಿದ್ದಾರೆ ಇವತ್ತಿನ ದಿನಕ್ಕೆ. ಅಂಡ್ ಈಸ್ ಎ ಸರ್ಜಿಕಲ್ ಆಂಕಾಲಜಿ. ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ, ಸರ್ಜಿಕಲ್ ಆಂಕಾಲಜಿ ಓದ್ಬೇಕಾದ್ರೆ ಎಷ್ಟೊಂದು ವರ್ಷ ಆಗುತ್ತೆ, ಎಷ್ಟೊಂದು ದಿವಸ ಆಗುತ್ತೆ. ಅವರ ಒಂದು ಕನ್ಸಿಸ್ಟೆನ್ಸಿ ಮತ್ತು ಧೈರ್ಯ ಮತ್ತು ಆ ಒಂದು ಬದ್ಧತೆ ಇಷ್ಟು ದಿನಗಳಲ್ಲಿ ಇರಬೇಕು ಅಂತಂದ್ರೆ ನಮ್ಗೆ ಅವರ ಅಗಾಧವಾದಂತ ತಾಳ್ಮೆ ಮತ್ತು ಅವರ ಒಂದು ಕೆಲಸ ಮಾಡ್ಬೇಕು ಅನ್ನೋಂತ ಒಂದು ಶಕ್ತಿ ಎಷ್ಟಿದೆ ಅಂತ ನಮ್ಗೆ ನೆನಪಾಗುತ್ತೆ. ನಾವು ಅದನ್ನ ನೆನಪಿಸ್ಕೊಳ್ತಾ, ಸೊ ಸದ್ಯಕ್ಕೆ KMC ನಲ್ಲಿ ಈಸ್ ಎಲೆಕ್ಟೆಡ್ ಮೆಂಬರ್ ಫ್ರಮ್ ಮೈಸೂರ್ ಅಂಡ್ ಹಿ ಹೋಲ್ಡ್ಸ್ ದ ಪೋಸ್ಟ್ ಆಫ್ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್. ಮತ್ತೆ IMA ಮೈಸೂರಿನಲ್ಲಿ ಡಿವಿಷನಲ್ ಕೋಆರ್ಡಿನೇಟರ್ ಆಗಿ ಕೂಡ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಎಲ್ಲಾ ಕೆಲಸಗಳನ್ನು ತುಂಬಾ ಹಿರಿಯಾದದ್ದೇ ಇಟ್ಕೊಂಡಿದ್ದಾರೆ. ಸೊ ಮಾಡರೇಟ್ ಆಗಿ ನಿಮ್ಮನ್ನ ನಾನು ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ವೆಲ್ಕಮ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಸರ್. ನನ್ನ ಚಿಕ್ಕ ಇಂಟ್ರೊಡಕ್ಷನ್ಗೆ ಕ್ಷಮೆ.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್, ಥ್ಯಾಂಕ್ ಯು
ನಿಮ್ಮ ಸರಿ. ನೆಕ್ಸ್ಟ್ ನಾನು ಡಾಕ್ಟರ್ ಆದರ್ಶ್ ಅವನ್ನ ಕೇಳ್ಕೊತೀನಿ, ವೀರಭದ್ರಯ್ಯ ಸರ್ನ ಒಂದ್ ಸ್ವಲ್ಪ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಲಿಕ್ಕೆ. ಡಾಕ್ಟರ್ ಆದರ್ಶ್ ಇದ್ದಾರೆ ಸರ್?
ಗುಡ್ ಈವ್ನಿಂಗ್ ಆಲ್ ದ ರೆಸ್ಪೆಕ್ಟೆಡ್ ಮೆಂಬರ್ಸ್. Good evening Chinivalar sir, good evening Veerabhadraya sir, good evening Suriraju sir, and our committee chairperson Dr. Suresh Kagalkar sir. So I'm going to give a brief introduction about our Dr. Veerabhadraya TA sir, who is president-elect for the year 2025-26. So sir was basically a deputy director from Health and Family Welfare Department, and he is presently the president-elect for IMA Karnataka State Branch and also the member of Karnataka Medical Council, Bangalore. So he has done lots of services to KGMOA, which is Karnataka Government Medical Officers Association, and was also district surgeon at District Hospital Tumkur. He was instrumental in starting DNB courses at District Hospital Tumkur, paramedical courses, nursing college and trauma care center in District Hospital Tumkur. He is also a recipient of many awards such as Best Secretary Award at KGMOA, IMA KSB Doctors Award for the year 2015, and Sarvottama Seva Award by District Administration in the year 2019. We are very happy to have you as a speaker today, sir. Thank you.
Thank you very much.
I request Dr. Rohini to introduce our second speaker, Dr. Pawan Kumar. Dr. Rohini.
Yeah. Sir, I've not received the CV. I'll introduce what has been given. Sir is a president of a Gadag branch IMA and was a vice president of IMA KSB. And sir is today going to speak about medical ethics and also about the misconduct and this misconduct. So I welcome you, sir, for the CME.
Thank you. Thank you.
Dr. Ravi Krishnappa ಅವರು ಮಾಡರೇಟ್ ಆಗಿರ್ತಾರೆ. So
Thank you, madam. Thank you.
now yes sir, the speaker
Thank you.
is
A warm,
Veerabhadraya.
Okay, madam. Thank you. A warm welcome and a very good evening to all the members who are presented here. First, I would like to thank to public committee for choosing this topic and educating the members of IMA, which is the most essential. And considering myself, after attending KMC inquiries, I have no hesitation to say this, that I changed my practice. I started more, I am giving more time to counseling and as well as explaining the patient's conditions. So in this way, I think the IMA, the present public health committee, they are doing a very good job. And moreover, I would like to say this very short period is not at all enough to give more information about ethics and as well as the proceedings which happens in day-to-day practice. But still, I would like to congratulate the committee for starting at least starting these type of topics. And coming to Dr. Veerabhadraya sir topic, Medical Council Act, sir, Dr. Veerabhadraya sir is a very well-known senior fraternity member in our IMA and as well as KGMOA. Sir Veerabhadraya sir, please, I welcome. Please start your presentation, sir. Sir is going to present about Council, Karnataka Medical Council Act. What are all the amendments which has happened from the last 5 to 10 years? Sir. He's going to speak about in a short time. Sir, please proceed, sir.
Thank you, sir. Thank you for the introduction. IMA Karnataka ಶಾಖೆಯ ಅಧ್ಯಕ್ಷರೇ, ಕಾರ್ಯದರ್ಶಿಗಳೇ ಹಾಗೂ ಈ ಒಂದು ಪಬ್ಲಿಕ್ ಹೆಲ್ತ್ ಸಬ್ ಕಮಿಟಿ ಅಧ್ಯಕ್ಷರೇ, ಕಾರ್ಯಕಾರಿಣಿ ಸಮಿತಿ ಸದಸ್ಯರುಗಳೇ ಹಾಗೂ ಈ ಒಂದು ವೆಬಿನಾರ್ ಅಲ್ಲಿ ಭಾಗವಹಿಸಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ IMA ಸದಸ್ಯರುಗಳೇ ಹಾಗೂ ನನ್ನ ಸಹೋದ್ಯೋಗಿಗಳಾದ ಡಾಕ್ಟರ್ ರವಿ ಕೃಷ್ಣಪ್ಪರವರೇ ಹಾಗೂ ಡಾಕ್ಟರ್ ಪವನ್ ಕುಮಾರ್ ಅವರೇ, ಈ ದಿನ ನನಗೆ ಈ ಒಂದು ಅವಕಾಶ ಕಲ್ಪಿಸಿಕೊಟ್ಟಂತ ಡಾಕ್ಟರ್ ಸುರೇಶ್ ಅವ್ರಿಗೆ ಮತ್ತು RP ಅವ್ರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಅರ್ಪಿಸ್ತಾ, ನಾನು ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ಆಕ್ಟ್ ಬಗ್ಗೆ ಸವಿವರವಾಗಿ ಹೇಳಲಿಕ್ಕೆ ಕಷ್ಟ ಆಗ್ತದೆ. ಯಾಕೆಂದ್ರೆ ತುಂಬಾ ಇದೆ, ತುಂಬಷ್ಟು ಅಮೆಂಡ್ಮೆಂಟ್ಗಳಾಗಿದೆ. ಪ್ರತಿ ಅಮೆಂಡ್ಮೆಂಟ್ ಅನ್ನು ಹೇಳ್ತಾ ಹೋದ್ರೆ ಸಮಯಾವಕಾಶ ಸಾಕಾಗೋದಿಲ್ಲ ಅಂತ ನಾನು ಭಾವಿಸ್ತೇನೆ. ಅದರಿಂದಾಗಿ ನಾನು ಕೇವಲ ಬ್ರೀಫ್ ಆಗಿ ಇದ್ರ ಬಗ್ಗೆ ಹೇಳ್ತೇನೆ. ಕರ್ನಾಟಕ ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ಆಕ್ಟ್ ಬರೋದಕ್ಕೆ ಮುಂಚೆ ನಾವು ಮೈಸೂರು ಮೆಡಿಕಲ್ ರಿಜಿಸ್ಟ್ರೇಷನ್ ಆಕ್ಟ್ 1931 ಅನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇದ್ವಿ. ಆ ನಂತರ ಇಂಡಿಯನ್ ಮೆಡಿಕಲ್ ಕೌನ್ಸಿಲ್ ಆಕ್ಟ್ 1956 ಜಾರಿಗೆ ಬಂತು. ದೆನ್ most of the people started why this Mysore Medical Registration Act. We should have our own Karnataka Medical Registration Act, and all the allopathic doctors should be registered with Karnataka Medical Registration Act. So some seniors like Dr. Chiknanjappa, they have started this Karnataka Medical Council, and it was recognized by the government of Karnataka in 1961, and Karnataka, under Karnataka Act number 34 of 1961, it was assented by President of India on 25/12/1961, and it was published in the Karnataka Gazette on 13/12/1961. From then, our Medical Council Act came into existence. So then, when the Medical Council started in 1961, there were 6 medical practitioners, and there were 2 faculties from medical university and 2 from medical colleges, and 5 nominated members from the state government used to be there, and among them they used to elect president and vice president to run the council. So register was the returning officer then, and the term for this was 5 years, and their KMC has got the civil code power. So you know what civil code how they conduct in district level and taluk level and even in High Court. So accordingly, we are practicing till now. So the registrations were followed according to the IMC Act 1956, and the degree, diploma, and masters were scheduled. Even some countries, English-speaking countries, 6 countries, the degrees from those countries were also scheduled in IMC Act 1956, and then the fees for registration was 15, and for renewal, it was happening on 31st of December every year by paying ₹2. And those who are not renewed, their name were to be removed under Section 30. And if they re-register, their name used to be re-entered into the registration register. Next. The First Amendment and Second Amendment were happened in 1970 and 1971 under this GSR 316 dated 31/8/1970 and GSR 1973 dated 21/6/1979, and the election of president and vice president were happening. They introduced this in amendment. At that time, the nominated members were not having power to elect the president and vice president. Only the members elected used to elect the president and vice president. The voting was by ballot, and registration fee for registration was 15 and renewal 2 as was there. And for copy of registration or Xerox copy of the registration copy, they were charging only ₹3. Next. The KMR Amendment Act 2003 came into in Karnataka Act 43 2003 dated 69 2003. There amended in Section 3B. There used to be 4 members among teachers of the university and 4 members nominated. One nominated other than Kemp-Chamber, like Nursing Council, Pharmacy Council, and Dental Council, and Ayush Council. Their term used to be 1 year, and every year on rotation they used to be nominated by the government of Karnataka. And 4 other members elected from general practitioner side. In Section 13, fee was 15 was changed into prescribed fee, and renewal fee of 2 was changed to prescribed fee. This prescribed fee was 100 rupees, as I heard, and there was amendment for Section 13. They got the power to inspect the hospital and nursing homes if they receive complaints from any citizen of Karnataka. There is amendment for Section 18. There used to be an assessor to assist the president and vice president and council members during the inquiry of the cases against doctors. So in 2017, there was KMR Amendment Act dated on 6/4/2017. There was amendment for Section 3. There were 15 members. Now it is changed to 17 members. Among 17, 2 members from each revenue division, general category, and 1 each from teachers' constituency of each revenue division. Section 19, renewal every 5 years, and they should have 30 credit hours for renewal. And renewal, if not renewed, their name used to be removed, and it will be reinserted if they renew their registration. These were the amendments made in that. And the rules were made in 2019, number HFW 07 RGO 2017, dated 21/1/2019. And for rule, the election conducting officer, that is additional registrar or joint registrar or a KS officer should be returning officer, and separate electoral roll for each division has to be made. And all university teachers, whether it is Rajiv Gandhi Health University or deemed universities, all teachers working under all the universities are eligible to contest and eligible to vote. Each revenue division, if you want to elect from one division, the member should be from that division only, and the person who has to vote has to be from the same revenue division. And rule 10, it was 50 rupees for a candidate to contest for the election. It was changed to rupees 50 instead of 50 rupees in terms of DD. And in rule 14, ballot papers were introduced. It was amended that election procedure, before this amendment, they used to send the ballot papers to the address of the members to elect the members among ourselves. And then the ballots were to be sent back to the medical council, and they used to sort it out, and they used to elect the members. But now, after this amendment, every district will have one booth, and in that booth, every member of that division has to go vote for the members who have contested for the post of members KMC, teachers for the teacher constituency, and the general practitioners for whether he is specialist or general practitioner will be elected by each district booths in terms of ballot papers. So then the amendment for 43 rupees 1,000 for registration every 5 years of December 31st. December 31st of every year, every 5 years, one has to renew. Before that, it was every year, December 31st of every year. Amendment to Rule 43A, they have introduced CMA accreditation during this amendment, and for awarding credit hours, they have formulated some formula. Who has to conduct CMEs, who has to get the credit points, how many credit points one should get, and how many credit hours are required for the renewal. So these are all included in this amendment. I'm not going to tell you in detail about this amendment. And in 2024, as you know, Section 3D of 2, they have introduced women and other social groups should be given importance while nominating the members to the medical council. And they have amended 3A, election process, that how to conduct election in each district. And they have also amended Section 11 for registrar and other officers to the KMC, and they have amended Section 13A, that is unqualified quacks. You can take action against quacks by complaining to the local police through the register of KMC. And they have amended Section 16A, how to conduct inquiry and where to conduct inquiry. These are the procedures introduced or amended under Section 16A. And under Section 26, publication of list of practitioners on every 1st of January, as and when the Medical Council of India asks for the list of doctors registered under KMC. Thank you. If you have any doubts, you can ask. There is elaborative things are there, but it will take a lot of time. So, thank you all.
Thank you, sir. Thank you for your nice presentation, and thank you for your enlightening us. Any
Thank you,
questions
sir.
from the audience?
Dr. Virabhadraya,
Yes, sir.
what is GSR 316, GSR
Other
173?
government order number, sir.
Gೌರ್ಮೆಂಟ್ ಆರ್ಡರ್ ನಂಬರ್
Yes, sir. Yes,
ಓಕೆ.
sir.
ಆಮೇಲೆ ಈ ರಿನ್ಯೂವಲ್ ಎವ್ರಿ 5 years ಅಂತೇಳಿ ಏನು ಇದಾಗಿತ್ತಲ್ಲ,
ಹಾ, ಸರ್.
ಇಟ್ ವಾಸ್ ಟೋಟಲಿ ಅವಾಗ ಅದ್ರ ಬಗ್ಗೆನೆ ಅಗೇನ್ಸ್ಟ್ ಮಾಡಿದ್ವಿ. ಆಕ್ಚುಲಿ
ಹೌದು.
ನಾವೆಲ್ಲ
ಹೌದು.
1984 100
ಹಾ,
rupees ಕೊಟ್ಟು ಪರ್ಮನೆಂಟ್ ಅಂತ
ಹೌದು,
ಹೇಳಿ
ಸರ್.
ಕೆಲವ್ರು ಮಾಡಿದ್ರು ಅವಾಗ.
ಹೌದು ಸರ್, ಅದು ಅವಾಗ ಮಾಡಿದ್ರು. ಅದಾದ್ಮೇಲೆ ಇದು ಅಮೆಂಡ್ಮೆಂಟ್
Pawan, I think you can go for the question answer after Pawan presentation, so that most of the questions will be overlapping.
Okay,
Yes.
okay, sir.
Okay,
Okay.
okay, sir.
Yeah, thank you, sir. Dr. Pawan, the present Vice President of IMA Karnataka State Branch, and he's my colleague and member of Karnataka Medical Council. He's going to present very interesting topic about professional ethics and malpractice, the most important topic which is very essential for younger generation who are joining the practice. Yes, Pawan,
Yeah.
Dr. Pawan, over to you.
Good evening, everybody. Respected President, sir, Dr. Chinawala, sir, the Honorary Secretary of IMA KSB, Dr. Surya, sir. I would like to thank the Public Awareness Committee, Dr. Suresh Kalkar, Dr. Rajendra Prasad, sir, and all the members of the committee for introducing this topic and giving me this opportunity to present on professional ethics. To start off, I've particularly kept it as professional ethics. Why? Because any profession for that matter, whether it is advocate, whether it is chartered accountants or engineers, everybody have their own ethics guidelines. So, and it is a bonded duty of any citizen of India to have certain ethics in whatever they do. Like, for example, if you take the mercenaries, Gaundi antivalla, ಅವ್ರಿಗೂ ಒಂದು ethics ಅಂತ ಇರುತ್ತೆ. So ಹಾಗೆ similar way, every profession has its own ethics. But in our case, since we are dealing day in and day out with a human body and its life, the Medical Council of India has formulated guidelines for how to follow medical professional ethics, which includes a lot of things. The ethics part, the misconduct, and how it is dealt with. So I'll cover briefly on all these topics because it is a vast subject. I'll briefly cover most of it, and we can have discussion at a later time. What does ethics means is signifies moral values. So every profession should have its own moral values, how they deal with. And in medical ethics, moral principles to all the registered medical practitioners in their dealings with each other, as well as to the patients and to the state of law, is what is medical ethics involves. There is a bit confusion between what is medical ethics and medical etiquette. Medical ethics is how we deal, and etiquette is how we behave. So there are conventional laws, customs of courtesy, and code of conduct for doctors with his colleagues. So the basic law was formulated by MCI, but later on, now we have National Medical Commission, where nothing much has been changed in ethics formulation, but few things have been added and deleted. So it is mainly a recognition of medical qualification, which Indian Medical Council defines who is to be called as a medical practitioner. It supervises the Indian Medical Council, or NMC, supervises the undergraduate medical education, supervision of postgraduate medical education, recognition of foreign medical education or their degrees, and also the de-recognition of these degrees by people who are doing some amount of malpractice or unethical things. It also maintains a medical registry, what is called as National Medical Registry, which is on a regular basis updated by the state medical councils, where all the medical graduates register themselves. Then the councils also issues warning notices to the practitioners where a significant amount of malpractice or the deviation from regular medical ethical practices. Then they also pass an appeal against disciplinary actions. This last point says when a state medical council hears anybody for their malpractice or negligence or any other type of disciplinary action, the registered medical practitioner has an provision to go to appeal to the NMC. Suppose we at the State Medical Council take action against any medical practitioner, so they have the provision to go to the NMC to appeal that whatever decision the State Medical Council has taken, we would like to appeal on that. And it is similar to from district court, they go to state high court, and then high court to Supreme Court. So from State Medical Council, they have the provision to go to NMC. So the what are the roles of State Medical Council is they maintain the medical registry, they register the local practitioners, they control the disciplinary actions of the medical practitioners, they issue warning notices. When there is a common scenario where there is they notice that like recently you all might have seen that there was communal type of messages being circulated in doctors group. So the Karnataka Medical Council issued a notice in general saying that doctors who treat all the communities of the society are not supposed to end up in such type of activities in social media. That was like warning notices. Then there is something, this is significant, called as professional death sentence. Like the medical council, as Dr. Veerbhadra sir said, it has the civil court powers. We hear the patient grievances and the proceedings of that inquiry is as per the civil court proceedings. So in civil court, there can be financial punishment or disciplinary punishment. All such things happen in civil court. But what we have as a power in State Medical Council is that is called as professional death sentence. That is the council, state council, if it finds any misconduct, professional misconduct or negligence, they can either warn, they can temporarily cancel the registration of that medical practitioner, or a permanent cancellation of the medical practitioner can be done. So that is why it is called as professional death sentence. So once that is cancelled, the notice of that is sent to all the medical councils in the country, so that the practitioner cannot go to another council and register there and practice. So that's why it is called as professional death sentence. Now coming to different aspects of medical ethics, it is on different counts, like duties of medical practitioners towards patient. What is the basic principles of a medical practitioner toward patient is he has to treat a patient as an implied contract. If a patient comes to the reception and says, I want to show it to the doctor, that is called as implied consent. He himself is coming to your hospital and he is willing to show it to you. That is called as implied consent, and you are bound to treat him. Then the practitioners have a duty towards the sick. A patient is admitted or he's come sick, you have a duty to see him, examine and treat him. Duty to continue treatment. Suppose for some reason, you have admitted a patient, you are treating the patient, and for some reason he is not able to pay. It is not that you cannot say to the patient that you pay, then only I'll give you injection. No, you give him sufficient time, convince him, counsel him, continue the treatment. Don't stop the treatment for whatever reasons. Don't stop the reasons. Or if you are not willing, then give him an option to shift to a government hospital or any other hospital. Till that time, you are not supposed to stop the treatment. Duty to earn confidence. It is the duty of the medical practitioner to earn the confidence of the patients. Then duty to children and infirm. So whenever child or a person who is not in his firmity, that is in his conscious or is not in his state of mind, it is the duty of the medical practitioners to try and make him to calm down and then treat him. then the medical professional has a right to charge for his professional service. There is no bonding that it has to be charged so much or this much. It is his prerogative that he can charge for his services. Right to choose a patient. So this is a very vague rule. It doesn't mean that you are bonded towards one type of community or some other type of. If you feel that this patient is not yours, you can always tell him that I am not this specialty, and you can go to another specialty. So this rule says like that. It doesn't mean that a patient comes to you and you say directly, I cannot see you for whatever reasons. Due to give you proper directions. That is what is like. You refer him to proper directions, which specialty his ailment is. You direct him to proper treatments and the treatment protocols. Due to offer proper regime of treatment. That is what I now mentioned. Due to notify communicable disease. This is again an important thing, that whenever there is a communicable disease and there is a chance of this patient spreading this disease to somebody else, it is our duty to communicate it to the patient, how he has to take care that it doesn't communicate to the society, as well as whenever there is an for example, COVID-19 or some type of infection which is known to spread to the society, it is our duty to inform the concerned authorities also, like government and the local district health officers. Examination and consent, again, everybody knows about it. Duty as a regard result of examination. Professional secrecy. This is again, confidentiality is a very prime importance of medical ethics. We are bound to have and maintain the secrecy of any patient. It can be of whatever reasons. So you might see in a lot of hospitals, they have displayed in lifts that please don't talk about any patients on this room, in this lift. Because in a lift, there is a closed area where there are patients, patient relatives, and we as a doctors and our team, when we move into the lift and we discuss the patient about a patient. So patient secrecy has to be maintained, and that is a prime importance. When it comes to significant risk, then we are bound to inform the concerned authorities. Privilege, that is called as privileged communication. Bona fide statement of a registered medical practitioner on a subject matter of public interest to the concerned. If a patient is violent and he is bound to cause injury to the society, or he is bound to spread any disease to the family members or the society, it is bound duty to tell to the authority, concerned authority, in the interest of the community. Then conditions of privileged communication, that is about infectious diseases, venereal diseases, employer and employees, when there is a chance of an employee who has had a communicable disease or some other disease, which he can spread it to the, or it can be vice versa. A person who is working in a sawmill and is exposed to sawdust and has lung problems. It is our duty to inform the employer that he has a professional hazard for which he has to take proper precautions, or he should be changed in his duty type. Then about notifiable diseases, suspected crimes, patient's own interest has to also be taken into consideration. And also when a court demands of information about a patient, then it is our bond duty to inform the court about the patient. There, the conditions of privileged communication comes into place. Then duties of medical practitioners towards the state. That is again what I said, notification of infectious diseases, notice to the police, all these medical legal, any type of injuries where you find it is unnatural type of disease. In this part, they might ask, everybody is confused whether snake bite should be informed or a dog bite should be informed to the police. Yes, these, because of some untoward incidences in recent past, it is bound duty that any snake bite or dog bites has to be informed to the public, police, or to the concerned district authorities. Notification of birth and deaths, it's our duty. Issuing of certificates, this is very essential. We have to be very careful when we are issuing certificate. We, all my vice president or the member like Veerbhadra sir, accept this, that we have been getting complaints of fake certificates which have been issued by some of our members. I am not saying it is true, but even if you know somebody and you are issuing a certificate, see to it that without examining any patient, please don't issue any certificates. Respond to emergency military services. That is essential as part of the any country's law. Duties of medical practitioners towards one another. This is very, very, very important. And most of the inquiries what we get is because of this. Extend same honor. When same honor, respect, and gratitude behavior as expected from them to you. That is like if I expect that other colleagues should be right towards me, then I have to be right to them. That is how we see. That's what I keep telling, that respect is not demanded. It should be earned or received. So it holds good everywhere in any profession, and in medical profession also. Should not do or utter anything to lower down the name of any other colleagues. This is the most important thing. What I would like to mention here is, please don't talk any ill about any of your professional colleagues in front of any other public. He might not be your patient. He might not be your relative also. Please don't talk anything ill. It can be with respect to the finances aspect. It can be with respect to any patient treatment aspect. Please don't talk ill about it. If we stop this, I believe me, 90% of our all problems in this society, what we face as medical professionals, will end. Should not entice patients away from colleagues. We should not entertain patients that don't go to this practitioner, or you are admitted there, you come to me. All these type of things should not happen. This is again against medical ethics. Free medical services to philosophy. This, I think so many of us are following it. And I should congratulate IMA that we have very good schemes where mutual benefit schemes are. This is one of their examples where we have health schemes, we have professional indemnity, we have social security scheme, where all these three schemes believe on that each member helps all the members, and all members helps that one member who is in trouble. So that also holds good in, that is also included in medical ethics. Coming to professional misconduct. Conduct considered as disgraceful or dishonorable by professional brethren of good repute and competency. Again, as I said, don't speak ill about any of your other colleagues. Issuing of false medical certificate comes under medical professional misconduct. Covering up of unqualified persons, employing unqualified persons, then helping out quacks. It can be helping out on the mistakes done by them, or allowing them to practice under your banner, or maybe incentivizing them also is a grave professional misconduct. Then canvassing, that I will cover it in the last slide about canvassing. Sorry. And it is also not accepted to personally open a chemist shop. Lot of people have doubts that there is something called as dispensary. We can have our own lot of drugs in the clinic without a drug license. We can run and we can dispense the drugs. All that is false. One has to have a drug license to dispense the drugs. To prescribe habit-forming drugs, that is narcotics or other types of drugs. Disclosing professional secrets of patients is again misconduct. Failure to notify to the government on all the previous things, what I said, is again a professional misconduct. Treating patients under the influence of drink and drugs. This is very significant, and I urge all our professional colleagues kindly not do this. Again, I told fee splitting and dichotomy, that is incentivizing on referrals and other things, should in long run should stop. What is negligence or malpractice? Negligence, doing something that one is not supposed to do, or failing to do something that he is supposed to do. Many get confused with this dialogue. See, when a patient comes to me as a fever, I examine him top to bottom, find the source of fever, either by clinical examination or by investigating. Suppose this is the normal course any MBBS graduate will do. Suppose I don't examine him, I directly send him for investigation. See, that is the failing to do something that he is supposed to do. this becomes a negligence. I don't examine him, but I write entire list of investigations for fever. If I examine him, there is a possibility that I can narrow down the types of investigation. So that is where we go wrong. This is a one small, simple example I have given you. So either you are not doing anything which you are supposed to do, or you are failing to do something that is supposed to be done by a common MBBS graduate. Then professional negligence, absence of a medical practitioner in the treatment of patient which causes injury or any type of mental agony or death of the patient. These two are major significant negligence which we'll have to remember and always inculcate. What is civil negligence? That is, following conditions should be satisfied for proving liability. That is, one is duty, existence of duty of care by a doctor. That is what normally I have to do. That should be there. There should be a deviation from that. That I should have failed in my duty. Then that is first point. Second point is dereliction, failure on the part of the doctor to maintain applicable standard of care and skill. If any given doctor does normal course of care and treatment, and there is any deviation from that, that is called a dereliction. Then the third point is it should cause whatever this breach, either he has not done his duty or he has deviated, it should have affected in direct causation. Any damage was caused by the breach of duty. This is a very vast segment. This damage can be any type. It can be emotional damage, it can be physical damage like morbidity, mortality, etc., etc. And last thing comes is the financial damage also. So that is what is damage could be lost wages, medical expenses, and mental distress. So when all these are fulfilled, then only we can say there is a negligence which has happened. What is res ipsa loquitur? The thing or fact speaks for itself. When there is an obvious injury which is caused because of the negligence, it is called as res ipsa loquitur. So the defendant had full control over the agency or treatment causing injury. Like you were supposed to inject something and you have injected something. Like you were supposed to inject pantoprazole and you injected succinylcholine. That is a significant, obvious damage what you have caused. That is, it speaks for itself. That is what is the plaintiff did not contribute to the injury. Defense to negligence. No duty owed to plaintiff. That is, like there is no patient-doctor contract. Duty was discharged according to the privilege standard. Case of misadventure. It was error of judgment. These are all Supreme Court judgments where they say you fail to diagnose something and that is not a negligence. You have done all the examinations, you have done all the investigation, but you fail to judge a diagnosis that doesn't come under negligence. Then there is something called as contributory negligence. Like to say you have admitted a patient and after 2 days of treatment, you've still not come to the proper diagnosis and patient jumps and goes to another hospital. So he cannot label you that you did a negligent job, because there is a contributory negligence from him that he didn't stay back to you till you diagnosed and treated the patient. He ran away. So that becomes a contributory negligence. Or you have advised him something and he has not followed. That becomes a contributory negligence. Interventions of third party, limitations is 2 years, but now because of COVID and other things, this limitation thing has gone away. Contributory negligence, concurrent negligent act or unreasonable conduct on the part of the patient. Not a defense in case of criminal negligence, but yes, simple negligence is always there. Misadventure. What is misadventure? Is dangerous, unforeseeable effects following use of some procedure, measures, or drugs. It could be therapeutic, it could be diagnostic or experimental. Like you've gone out of the way and tried something new without having proper consent, it is misadventure. What is vicarious liability? It is this part is very essential for people who are part of a team. Like it could be a liver transplant team, or it could be a unit head in a medical college, or you could be a hospital owner where you have multiple consultants under you. The hospital also be vicarious liability, where liability of the employer for the negligent act of its employees. Like if I own a hospital and my consultant working in my hospital does this one, I'll be equally responsible for that within the course and scope of their employment. The principle of respondent superior, that is, I become as a hospital owner or the team head becomes the respondent superior. Criminal malpractice, that is again, medical practitioner prosecuted in criminal court on the charge of having caused death of his patient comes under criminal. It could be because of rash or negligent act not amounting to murder. That was earlier under 304A, but now under BNS, it comes under 106 BNS. Then coming to the last slide, as I told, advertisement, a lot of people have confusion, and these new NMC regulations have come where advertisement and association with pharma companies. As an individual professional, it's against the medical ethics to advertise, but what is allowed is you can display or publicize your medical specialty available in the hospital. The availability and absence from service can be published in newspapers. Timing of services can be displayed. One thing which is not accepted is providing information about guarantee of treatment. Like you are giving some treatment and you guarantee 100% you'll be cured or you'll be treated out of it. That is not allowed as per the medical ethics. Then again, incentives, receiving incentives from any medical companies, whether it is drug companies or equipment companies, in any form is not acceptable as per the medical ethics. So I would like to conclude here is one has to never forget the profession, what we have chosen for. Never compare amongst each other profession, whether it is same specialty or different specialty. Whatever done, keeping patient as the point of interest will have better outcomes. This is at most important point. Explain the patient treatment options as if you are advising the same to your family member. If you, many of them follow this. For myself, I have been following it for years now. And believe me, we hardly see any type of conflict of interest when it is done in this, keeping this in mind. So if you make it a habit, I doubt that any cases or litigations will come into force. Never consider finances as the main agenda in our profession. Finance is a byproduct of our profession. You serve, money will flow as it comes. If that comes as a second or last point in our practices, I feel again there will be less type of litigations happening. Never talk ill about your profession or professional colleagues. Even a smallest comment would lead to litigations by the patients. Follow all state laws and national laws in practice. And also, I would urge every member to read these laws. Just don't believe me or anybody else who is telling you that this is like this is like this. We tell you out of whatever we have grasped from the law. When you read it, you might find out some other point which we have not told you. So please make it a point that whatever laws they are pertaining to your practice, they are easily available on Google now. Open it, read it, and try to understand it. If you have any doubts, you can ask your senior fellow. Please don't just follow what we as leaders or what we have read and say in these such type of forums. Not all is true what we say. So better is you have first-hand information. That will help you a lot. Thank you. And I'll be happy to answer any of your queries. I don't say that I know everything, but as far as I can answer, and then you can also suggest or guide me. And also, please feel free to share your inputs and suggestions. Approach me for any type of help. These are my contact details. You can always approach. Thank you.
Thank you. Thank you, Pawan. Thank you for your nice presentation and well narrated about the topics of medical ethics. Any questions from the audience?
Hello.
Hello.
Dr. Padma Prakash.
Yes, madam.
Hello, sir. My question to Dr. Veerabhadraya, sir. Sir, throw more light about the KMC amendment, sir. Who takes the decision and what is the procedure?
Madam, amendments are made through legislative assembly. They are approved there, and it will be gazetted in the Karnataka Gazette.
It
So
should
it's
be
not
get
through
approved.
it's not
One
through the
Actually,
cooperative department, so who conducts the
election, that is, election is
ROs.
conducted through cooperative department.
Mm.
But this act amendments are made. The proposal is sent from the medical council, and those amendments will be discussed in the legislative assembly as well as the council, and then it will become the act.
So when was it happened, sir? In 2024, last year?
Yeah,
Which month
2024
it happened?
was the last.
That what, which month?
July, madam.
1 second.
July or August.
16th legislative assembly. It is in.
Hello.
ಹಲೋ
One second, I will tell you.
Hello.
sir, ಹೇಳಿ.
Sir, I must compliment Dr. Pawan and Virbhadraya. And it's very vast subject. They made it a very crisp and a very simple language, understandable to every members. It's something like they both of them they produced like something like a bare act. So my compliments for both of you. It was very simple, very audible, and a very clear-cut message thrown out to the KSP members, I would believe. Thank you for both of you. Even Dr. Ravi Krishnappa, you moderated very well, and thanks everyone.
Thank you, sir.
Thank you, sir. Thank you.
There is a question which I think so Dr. Raja Arjun has asked. Are we still following Code of Ethics 2002? NMC Professional Code of Conduct 23 are held in abeyance. Please educate us on the duties of the doctor in case of emergency. Till what extent treatment should be given when the patient cannot afford the treatment? Yeah, I would like to see as per the NMC Professional Code 2023 and the MCI 2002, there are not much significant changes except for few of the points which have been added. Coming to the second point on duties of the doctor in case of emergency, it is a bound duty of any doctor to treat any type of emergency patient comes to you, to give him the whatever possible first aid. Like you are a surgeon, you get an MI patient. What is the basic thing you are supposed to do is you do an ECG, you give him the basic initial drugs like aspirin or something, and then as far as possible, help him out to reach out the nearest possible place where he can get treated for his cardiac ailment. Or an RTA comes, as you have written, affordability. RTA comes, he is injured. If you feel that he is fractured, put a slab and then send him. Or if he just has a wound, you put a dressing, simple dressing, and send him. So these are the basic things. We need not be medical professionals. As a human being also, we are supposed to do this. That is what is my concern. And my
Ethically, morally, professionally, we are bound to do first aid to the any emergency, whether they pay it or not. Yeah.
Yes.
See, I have a question here.
Sir, please, sir.
Affordability is there actually. The patient has come to my hospital. Affordability, we will leave it. We do the first aid and send him somewhere if he can afford. Or if it comes to some other places also, if he doesn't have somebody to take care of him, to take him to the other hospitals, or anywhere we want to send or we want to go, what is the point? How it will be treated?
Sir, one is a question of affordability.
This is a tricky one actually.
Pardon?
This is a tricky one actually.
Yeah,
No,
can
sir,
please
the question of affordability is different, and the question of the attender presence of attender is different, sir.
If the patient is conscious and he is able to make good judgments, you can ask his consent where he wants to go and you can shift him there. That is one point. If he is not conscious and it is your duty to report it to the police that we have received such an unidentified patient who is unconscious, either in an RTA or another way, somebody has got him there, and shift him to the nearest government hospital, what is right. If you can treat with basic initial treatment, suppose his saturation is low, start him on oxygen, give him a proper position. If you feel that he's in failure, give him an injection of Lasix, and then shift him to the nearest place. Don't shift him just like that. That is my concern.
Yeah, I agree with you. If the patient is unresponsive, the question of affordability will not come. But the one who is taking care of, who is accompanying matters, that time, as you rightly said, you have to just inform the police. I think police can do a better job, and they can, the rest of the things can be read by them.
And one more question,
it's
Pawan.
not
One
so
more
easy,
question is
excuse
from
me.
by Dr. Girish Malagad.
Yeah.
Hi, Girish.
Shall I continue in between? I'm interrupting you.
Yes, sir. Yes, sir.
moderator,
Yes, sir.
The question is,
Yeah.
a doctor brings
In
his
government
patient and
hospitals
operates
also.
him in other hospital,
Dr. Ravi.
and it's get complicated. I think you are reading that question.
Yeah, yeah. No, Sarvesh Raj sir has not finished. After that, we'll take him.
Yeah.
Harash sir, you are telling.
In government institutions also,
Hmm.
I'm retired now. Before we
Yeah.
have faced so many problems there actually.
Yeah.
The patient comes in an emergency, RTA or any other things.
Okay.
He will be brought by somebody, one
Mhm.
who will be going on. The thing is, apart from an ambulance 108, he will come and leave it in the hospital.
Okay.
That ambulance will go off. If we
Okay.
inform the police also, they say we don't have so many number of personnel to shift him to this one with the police. We will contact their relatives if possible. Then we'll get him. That's why I told you, Tricky. Nama hospital when I was doing duty also. In the government institutions, it's okay. If it becomes in a private institutions, what was the question? Continued one I'm asking. The thing is, how to go ahead with that one? We'll be informing the police. Do that one also. It doesn't. Does it become a negligence if we treat him also? Then if the negative thing occurs before the person relative comes and all, how to manage that one?
Sir, I that's why I clearly mentioned there are two scenarios. One is patient conscious, able to take a decision. You ask him, and then if he's willing to continue treatment, you take his consent and continue the treatment till either police or his relative comes. This is one point. Or if he's conscious and he wants to get shifted to another hospital, private or government, you shift him there when he's conscious. Second point comes is when he's unconscious, when he's not able to take a decision. He's not in his cognitive state to take a decision. It is your bond duty to continue the treatment without his consent. It is accepted in law. When a patient is not conscious, you can continue treatment. Either you can give him first aid. Sir?
Documentation is important here.
Documentation is important. And police intimation documentation will be there with you.
Yeah, everything.
So, if you feel you can manage him there, you can manage him. If you feel you cannot manage him, you can shift him to the better hospital, either private. Most of the private hospitals might not take an unidentified or unattended patient. So best is to shift him to the nearest government hospital with whatever means you have.
What we used to do in the hospital is, first one we used to give the intimation to the police.
Yeah.
Then the second intimation we used to give that one, no relatives are there, and he is unable to give the his address or contacts also, but he needs immediate higher center treatment.
Yeah.
So please arrange for the same to take him to the higher hospital for the referral. Please write and give one more intimation to the police.
Yeah.
So that's what I was taught by our senior, one few of our seniors used to give that one. Probably
yes, sir. Basically, documentation, sir. Documentation.
Service, both things should go simultaneously. Treatment, first aid should continue along with the intimation to the police. By the time you finish the first aid treatment, the police should come and take over that. They can be under their custody. It is something like if the patient is unresponsive, unconscious, it's something like a MLC only. So to just inform the police while doing the first aid treatment, whatever you can.
Yeah.
Sir, one question.
Pawan,
Yeah.
Dr. Pawan.
Veerbhadra sir, one question.
Please answer that question answer the question of Dr. Girish.
Yeah, I'll read out the question of Dr. Girish. A doctor brings his patient and operates him in others hospital, complicates.
Hospital means any XYZ hospital.
Yeah, a visiting consultant. I would like to mean that a visiting consultant.
Yeah, basically
creates
he is a
complication.
visiting consultant.
Yeah, and patient complains. Who is responsible, doctor or hospital? See, when we get any complaint from the patients, it is clearly mentioned who are all the parties in the complaint, whether it is a hospital, whether it is the consultant, it will be mentioned in the complaint. So whoever the complaint comes on is inquired, and the necessary inquiries are done accordingly.
Vicarious liability, sir.
Rule that if the case has happened in the hospital is liable. There are judgments where only the consultant has been penalized. There are examples and orders where hospital is also penalized and the consultant is also penalized. So that's why we usually tell that the individual indemnity is also important and the hospital indemnity is also important when it comes to professional indemnity. I hope the answer is clear.
So basically,
right.
So
Yes, sir. Thank you,
conclusion, it's responsibility depends on the patient to whom he is complaining.
Yeah.
That's it.
And especially hospital role comes when there is some mishap which has happened because of the
lack of infrastructure,
lack of equipment or equipment malfunction. That time probably a hospital or the hospital owner liability comes.
So vicarious liability, sir. The hospital is liable, sir, irrespective of whether the doctor is a consultant.
No.
Not always.
Suppose not always. It all depends on the type of complaint you receive. See, a staff has created a problem, then hospital becomes a responsibility. A staff nurse who has created any mishap, like a wrong injection is given or something has happened, then hospital becomes liable. The consultant as well as the hospital becomes liable because the staff nurse is employed by the hospital and not by the consultant. Suppose there is a malfunction of a drill which is being used by the orthopedician and that is being noticed by the patient and he raises a issue on that drill also in his complaint, then hospital becomes a liability as well as the consultant because he has not checked the machine before he starts using it. So there are
Veerbhadraya sir.
Yes, sir.
Yes, sir.
Sir, one more question is in the chat box. Is it necessary to do renewal of registration from Dr. Sharda Karath?
Yes, sir.
So please
Even
reply, sir.
NMC tells there is need of renewal every 5 years with credit hours.
Every 5 years.
Okay, sir. I think it's still taking much of time. It's already 10:20. I think better to end the session now. I will give and I would like to thank the Public Health Committee of the IMA KSB for giving me this opportunity. Sir, Dr. Suresh Kavakal, sir, I will.
Yes, sir. Sir, one small.
Sir, are you there, sir?
Yes, sir.
So over to you, sir.
Yes, sir. Dr. Veerbhadra, sir, one question. It is for usually for all the members.
Yes.
Now, whenever there is a professional negligence case comes, so usually what they will go to the consumer court. So consumer court will make a redressal committee and they will take this own the route. What about the role of this KMC whenever to guard the doctors? So what is the role of KMC in order to guard the doctor? In order to proceed to the consumer court. So the consumer court and government action is different. Redressal committee that will take a different action. So what about KMC role to guard the doctor? This is one question. Second one is yes, sir. Yeah.
Most of the consumer courts, they send the cases to KMC for confirmation whether there is negligence or not. If we say there is no negligence, they will not go forward. They will dismiss the case. If we say it is there is negligence on the part of doctor or the hospital, they will definitely penalize the hospital or the doctor.
So who has
Can
to
I add here, sir? Can I add here?
Yes, sir.
Yeah,
Who
yeah.
has to appeal to the KMC?
Yeah. See, in KMC, we receive complaints directly from the patients. We receive complaints from the police. We receive complaints from Consumer Forum. We receive complaints from the Civil Court, High Court, and from NMC also. So once we receive such complaints, we initiate the inquiries. In law, what is there is something called as Boehm's law. What it says is, any misconduct or negligence by any professional, it has to be judged by a professional body. But in our judicial system, there are laws where Boehm's law is upheld. There are judgments which have gone against the Boehm's law. That is, the professional body has given its opinion that there is no negligence and there have been orders against it. And it has been questioned in higher court and again it has upheld. So it is Boehm's law is there, but it is not mandatory that whatever the professional body opinion is given should be taken into consideration by the judge in other courts. But significant times it is considered that professional body expert opinion is considered in any type of court, whether it is consumer court, civil court, or high courts also.
Yeah.
Hope it is clear, sir.
Yes, sir.
Yes.
Sir, once again, Dr. Padma Prakash here.
Yeah, madam.
Sir, there are so many doctor YouTubers where they'll update about the patients' details, and even they invite the patients, sir, to do chit chat with them. So
Even if it,
is it with the consent of the patient? Is it okay?
Yeah, sorry, I didn't cover that part. It is a part of professional secrecy, madam. Any type of videography of the patient, either it is surgical or a testimonial videography of the patient, should be with the consent of the patient. If it is not without the consent and if they publish that, patient is bound to raise a litigation against the doctor.
With the consent of the patient,
with the consent, it is accepted. But now recently we have had some
Supreme Court says
guidelines from NMC and Supreme Court that social media testimonials should not happen for doctors. But there is even further guidelines is supposed to be coming from NMC or other bodies.
Okay. Hello.
Rajiya, one question, sir.
Yes, sir.
Very good presentation from Dr. Veerabhadraya sir and Dr. Pawan sir. See, one thing is regarding the KMC renewal, people very often ask me wherever I go to IMA, local branch visit, if it is delayed or if it is not done renewal, is there any penalty or is there any chance that name will be removed from the KMC? That's one question, sir. That's very often they ask. And second thing is, yes, sir. I want.
Sir, actually, if you are not renewed, your name will not be removed permanently, but your name will be kept aside.
Okay.
So, if you renew after some time, some 1 year, 2 year, or 3 years, by paying penalty, your name will be re-registered, re-entered. Okay. Your name will be there. Your registered number will be same.
Okay.
But if you have not renewed, your name will be kept aside. That's all.
Okay.
I would like to add here, sir, one point.
Yes, sir.
A lot of people feel that what will happen if I don't renew? Most of the inquiries, what we are seeing, the first question what the complainant advocate asks the medical practitioner is whether your degree is renewed and registered. Registered and renewed. The first question what they ask. So if you fail there, the entire case falls off. It is just like, as everybody says, without a driving license, you are driving a vehicle. That is what usually everywhere it is said.
And one more thing I would like to add is professional indemnity insurance.
Yeah, they are not covered.
If you don't renew, they don't cover.
Yes. Hello.
And second question is, we are very often coming across, they are getting some people, fake certificates, sir. These days, they are getting confused with the KMC versus IMA, we often get complaints. Recently, I came across our president was telling about same thing, Dr. V. Chinavala. We received a complaint about a doctor whose certificate is doubtful. Kindly check. One question. I received a phone call from the police station. Some XYZ person has given the complaint, sir. So, in this situation, as a responsible citizen, should we bring it to the notice of KMC and make sure that is getting punished?
You can always cross check, or you can refer this such type of complaints to Karnataka Medical Council. We receive a lot of such requests where to check the authenticity of any medical practitioner registrations.
And the second thing is, any hospital before taking the doctor
from abroad, sir. If somebody goes to America, US, UK, and all, they will send his certificate for verification whether this is genuine or not.
Okay.
So much so in our country also.
And
we have to verify.
Yes,
if we find that we have received so many cases where name of the doctor is something, and this photo will be impersonalized by somebody. So photo will be of the one who is practicing there, and the name and the list number, everything will be of somebody else. So such cases we have found, especially from Udupi. So we have informed the local KPMA authority to take action against those persons. So they filed a case with the local police, and they were arrested, and they were put behind the bars. Some 4 cases were reported from Udupi district 3 years ago.
And the second thing is, most of the hospitals, sir, we fail. I mean, sir, they don't cross-check in the Karnataka Medical Council whether these certificates.
Can I add here, sir? One thing. The KMC website and the KMC software is so beautifully designed.
Okay.
Anybody can check the validity of the certificate. There is a QR code on everybody's certificate.
Yes.
You just, nowadays smartphones are there. You scan the QR code, you get the details and authenticity of that certificate.
Thank you.
Very good.
You yourself can check now. Wherever you have your own certificates, you can scan the QR code. All your details, including your photograph, comes on the page.
Okay.
And even on website, you can check it.
Hello, Pravan. Very well covered. Really.
Basically, for patient, if suppose, for example, if your patient can scan that QR code and can check the authenticity of the certificate.
Certificate, yes.
ಲಕ್ವ ಸರ್ ಏನು ಹೇಳ್ತಾ ಇದ್ದಾರೆ?
ಇಲ್ಲ, ತುಂಬಾ ಒಳ್ಳೆ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ನೀವು ಸುರೇಶ್ ಕರ್ಕರ್ ಹಮ್ಮಿಕೊಂಡಿದ್ರಿ. ನಿಮಗೂ ಧನ್ಯವಾದಗಳು. ನಮ್ಮ ಚೇರ್ಮನ್ರಿಗೆ, ಪ್ರೆಸಿಡೆಂಟ್ಗೆ, ಹಾಗೆ ಪವನ್ ಮತ್ತು ವೀರಭದ್ರ ಅವರು ಸಂಕ್ಷಿಪ್ತ ವಿಶಾಲವಾದಂಥ ಸವಿಸ್ತಾರವಾದಂಥ ಸಬ್ಜೆಕ್ಟನ್ನು ಶಾರ್ಟ್ ಟೈಮ್ನೊಳಗೆ ಎಲ್ಲ ಇನ್ಫಾರ್ಮೇಷನ್ ಕೊಟ್ಟಿರೋದಕ್ಕೆ ನಾನು ಅವರಿಗೆ ಹೃತ್ಪೂರ್ವಕವಾದ ಧನ್ಯವಾದಗಳನ್ನು, ಅಭಿನಂದನೆಗಳನ್ನು ತಿಳಿಸ್ತೇನೆ. ಹಾಗೆ ಅಸಿಸ್ಟೆಂಟ್ ವೈಸ್ ಪ್ರೆಸಿಡೆಂಟ್ ಆಗಿರ್ತಂಗೆ KMC ರವಿಕೃಷ್ಣಪ್ಪನವರು ಪೇಷನ್ಸ್ ಆಗಿ ಎಲ್ಲದನ್ನು ಮಾನಿಟರ್ ಮಾಡ್ತಾ ಮಾಡ್ಯುಲೇಟರ್ಗೆ ಅಭಿನಂದನೆಗಳು. ಹಾಗೆ ಇಂಥ ಕಾರ್ಯಕ್ರಮಗಳು ಮುಂದೆ ಬರಲಿ ಅಂತ ಹೇಳ್ತಾ ಎಲ್ಲರೂ ಪೇಷನ್ಸ್ ಆಗಿ ಕೇಳಿದ್ರು. ಇದು ಅತಿ ಅವಶ್ಯಕವಾದಂಥ ಸಬ್ಜೆಕ್ಟ್. ಮತ್ತೊಮ್ಮೆ ನಿಮಗೆ ಧನ್ಯವಾದಗಳು ತಿಳಿಸ್ತೇನೆ, ಅಭಿನಂದನೆಗಳು. ನಮಸ್ಕಾರ.
ಚಿನಿವಾಲ ಸರ್ ಇದ್ದೀರಾ ಸರ್? ಚಿನಿವಾಲ ಸರ್, ಪ್ರೆಸಿಡೆಂಟ್ ಸರ್.
ಒಂದ್ ನಿದ್ದೆ ಆಗಿರ್ಬೇಕು ಅವ್ರದ್ದು ಈಗಾಗಲೇ. ಮತ್ತ ಅದೇನ ಕೇಳ್ಬೇಕಂತ ಇದಲ್ಲ.
ಕೇಳಿದೆ ಸರ್, ಅದೇ
ಬೆಂಗುಂಟಿ ಮಹಾರಾಜರ ಅದನ್ನ ಕೇಳ್ತಾ ಇದ್ದೀನಿ.
ಅಲ್ರಿ, ಮೊದ್ಲೇ ಬಾಂಬ್ ಹಾಕಿ ಸುಮ್ ಕುಂತ್ ಬಿಟ್ರೆ ಹೆಂಗಿದು? ಏನ್ ಹೇಳ್ರಿ
ಅದ್ರ ಬಗ್ಗೆ ಸೂರ್ಯರಾಜ್ ಅವ್ರು ಹೇಳಿದ್ರಲ್ಲ.
ಹೌದು, ಹೇಳಿದ್ರಿ. ನಾನೇ ಕೇಳ್ಬೇಕು.
ಅದಕ್ಕೆ
ಫಾಲೋ ಅಪ್ ಮಾಡ್ತೀವಿ ಸರ್.
ಎಸ್ ಸರ್, ಮಾಡಿ ಸರ್. ಅದನ್ನ
ಎರಡು ಒಂದು ಕೇಸ್ ಬಂದಿದ್ದು ಈ ರೀತಿ. ಈಗ ಪವನ್ ವೆಬ್ಸೈಟ್ ನಲ್ಲಿ ಹೋಗಿ ನಾವು QR ಕೋಡ್ ಸ್ಕ್ಯಾನ್ ಮಾಡ್ಕೊಂಡು ಅದನ್ನ ಪ್ರಿಂಟ್ಔಟ್ ತಕೊಂಡು ಬೇರೆಯವ್ರು ಏನಾದ್ರು ಇದ್ರ ಮಿಸ್ಯುಟಿಲೈಸ್ ಮಾಡಬಹುದೇನೋ ಅಂತ
ಇಲ್ಲ ಸರ್, ಸರ್ಟಿಫಿಕೇಟ್ ಬರಲ್ಲ ಸರ್. ನಮ್ದು ವೆಬ್ಸೈಟ್ ಒಂದು ಪೇಜ್ ಓಪನ್ ಆಗುತ್ತೆ ಸರ್. ಅದರಲ್ಲಿ ಅವ್ರ ಫೋಟೋ, ಅವ್ರದ್ದು ಯಾವ ಕಾಲೇಜಲ್ಲಿ ಮುಗಿಸಿದಾರೆ ಅದೆಲ್ಲ ಡೀಟೇಲ್ಸ್ ಬರುತ್ತೆ ಸರ್. ಸರ್ಟಿಫಿಕೇಟ್ ಬರಲ್ಲ ಸರ್.
ಓಕೆ. ಈಗ ನಿಮಗೆ
QR code is linked with our website,
ಹಾ
so they cannot just copy and use it.
ಓಕೆ. ಈಗ ನಿಮಗೂ ಮತ್ತು ವೀರಭದ್ರಯ್ಯ ಅವರಿಗೆ ನಾವು ಫಾರ್ವರ್ಡ್ ಮಾಡಿ ನೋಡಿ, 2 KSB ಬಂದು
Yes sir, yes sir.
ಚೆಕ್ ಮಾಡ್ತೀವಿ.
ಅದನ್ನ ನೋಡಿ ಸ್ವಲ್ಪ ಜಸ್ಟ್
Yes sir.
ಬಹಳ
ಈಗ ನಾವು QR ಕೋಡ್ ಎಲ್ಲ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಕ್ ಮುಂಚೆ ದೊಡ್ಡದೊಂದು ಸರ್ಟಿಫಿಕೇಟ್ ಬರ್ತಾ ಇತ್ತಲ್ಲ ಸರ್, ಅವಾಗ ಫೋಟೋ ಅಂಟಿಸ್ತಾ ಇದ್ರು. ಇವಾಗ ಏನಂದ್ರೆ ನಾವು ಫೋಟೋ ತೆಗೆದ್ಬಿಟ್ಟು ಹಂಗೇನೆ ಇದಾಗುತ್ತೆ ಸರ್, ಅದು ಸ್ಕ್ಯಾನ್ ಮಾಡಿ ಸರ್ಟಿಫಿಕೇಟ್ ಒಳಗೆ ಬರ್ತದೆ. ಮೊದ್ಲೇನಾಗ್ತಿತ್ತು, ಫೋಟೋ ಅಂಟಿಸ್ತಾ ಇದ್ವಿ, ಅವಾಗ ಆ ಫೋಟೋ ಕಿತ್ಬಿಟ್ಟು ಬೇರೆ ಫೋಟೋ ಅಂಟಿಸ್ಕೊತಿದ್ರು. ಆ ಡಾಕ್ಟರ್ ಹೆಸರು ಅದೇ ಇರ್ತಿತ್ತು, ಅವನು ಅದೇ ಹೆಸರಲ್ಲಿ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇದ್ರು. ಈಗ ಅವಕಾಶ ಇಲ್ಲ ಸರ್.
ವೀರಭದ್ರಯ್ಯ, ಈಗ ಪ್ರತಿ 5 ವರ್ಷಕ್ಕೊಮ್ಮೆ ರಿನ್ಯೂವಲ್ ಮಾಡ್ಲೇಬೇಕಾ?
ಹೌದು ಸರ್, ಇವನ್ NMC ಸೇರ್ತು.
ಇದಕ್ಕೇನಾದ್ರೂ ಏಜ್ ಲಿಮಿಟ್ ಇದೆಯಾ?
ಇಲ್ಲ ಸರ್, ರಿನ್ಯೂವಲ್ ಮಾಡ್ಬೇಕು. ಈಗ CME ಕ್ರೆಡಿಟ್ ಪಾಯಿಂಟ್ಸ್ ಗೆ 65 ಇಯರ್ಸ್ ಮೇಲೆ ಏನು ಬೇಕಿಲ್ಲ ಸರ್.
65 ಇಯರ್ಸ್ ಆದರೂ ಅಂದ್ರೆ ಈಗ ಲಕ್ಕೋಳ್ ಸಾಹೇಬರಿಗೆ ನಮಗೆ ಯಾವಾಗಿಲ್ಲ ಈಗ.
ಹೌದೌದು, ನಮ್ಮನ್ಯಾಗ ತಗೊಂತೀವ್ರಿ, ನೀನು ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋದು ಬಿಟ್ಬಿಟ್ಟು. ಯಾರು ದುಡ್ಡು ಕೊಡ್ತಾರ ಕೇಳ್ರಿ, ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡೋದ್ರಿಂದ KMC ಹಂಗಾರ ಮಾಡೋದಂತೆ.
ಥ್ಯಾಂಕ್ ಯು ಸರ್.
ಓಕೆ ಸರ್, ಓಕೆ, ವೆರಿ ನೈಸ್ ಸರ್, ವೆರಿ ನೈಸ್, ವೆರಿ ಇನ್ಫಾರ್ಮೇಟಿವ್ ಟಾಕ್ ಸರ್, ಬೋತ್.
Thank you sir, thank you very much.
Thank you sir.
Thank you sir. Good night sir, everyone. Good night sir.
Normally I invite Dr. Rajendra Prasad sir to say good vote of thanks.
Yes sir.
Yes sir.
Our thanks to Dr. Chinivalar, our state president, and thanks to Dr. Ravi Krishnappa, vice president of KMC, Dr. Veerbhadraya, member KMC, and Dr. Pawan Kumar Patil, member KMC, and Dr. Suri Raju, our secretary, and Dr. Suresh Kagalkar, the chairman of IMA Public Health Committee, and Dr. Indira, and we have got many dignitaries here, Dr. Shivkumar Lakul, Dr. Shivkumar Kumbar, Dr. Harish Delantbettu, Dr. Padma Prakash, Dr. Sarvesh Raje Ars, and Dr. Dagumati Hari, Dr. Jay Prasad, and our committee members, Dr. Adarsh, Dr. Rohini, and Dr. Rajalakshmi, and all the members of IMA KSB, and the doctors who attended today's program. Thank you. Thanks to everyone.
Thank you, thank you, thank you. Good night, Rajendra Prasad.
Thank you.
Good night to all.
Good night sir.
Good night sir. Thank you sir. Thank you everyone sir.
No, Prakash madam, good night.
ನಮಸ್ಕಾರ.
Good night sir, good night.
President sir, ನಮಸ್ಕಾರ, good night.
Next to John. John ಅವರಿಗೆ thank you. You have coordinated. John ಅವರಿಗೆ thank you ಹೇಳಿ sir. Thank you. Good night to everyone. ಮತ್ತೆ sir. Thank you sir.
Thank you John. Thank you.
Good night sir. Good night sir.
Good night sir.